Welcome to part 2 with the Dr. Okioga, who is a pharmacist, and we continue from here. As he had said, he's a pharmacist who just is working in Iowa. Now, Dr. Okioga, my question now, I want you to give us what, as now a pharmacist, what future plans do you have as a pharmacist? What future do you have for yourself and the community?
Thank you so much. And it's a very difficult question to answer. It's like, when you go to the interview and they ask you what is your 5-year plan, what's your 10-year plan. I have devised a way of answering that question, but for our viewers' sake, I'll just go straight to it. One, ever since I became a pharmacist, my mindset has switched. And it has switched in a way that I have started now thinking not life as an employee, but as an employer. Mm-hmm. When I go to Walgreens and work there, I don't go there working as an employee. I go there working with the mindset of an employer. If this was my company, how will I want it to be? Because I know if it succeeds, I still have a job. If it fails, I don't have a job. Okay. I don't have a source of income and stuff. So as a result, I've started thinking like that. And with that mindset, I'm working on probably one day owning my own business. And or if not a pharmacy, I also, as I said, speaking engagements. Okay. And I've started working on what we call Dr. Okioga Inspirations. So more details will be coming. And on top of that, also, I have 2 books that are almost being published that are coming to inspire. So you can read this story. We can't cover everything in just a span of 2 hours. Yeah, there's a lot, and I know you have so many questions that if you are here, I will answer. So that's one. That's 2 things. The third thing is I want to be more involved in the community. I want to give back to the community. We are so fortunate that we have become so many experts in this community compared to the time we came here, and we think it's time we can give back. I have a few friends, we are organizing something, and I'm challenging Dr. Mandi here. Okay. Yeah, with all these young people and other people. You don't have to be young. That's sometimes where we go wrong. Yeah, it's never too late to get started. If you still have your ambition, the kids are grown and gone, come listen to us. We can have a question and answer session. We can talk, we can inspire you, and we may share ideas. We're not going to give you every piece of the puzzle, but probably you need one piece of the puzzle to make it complete. That's where I may come in. So basically to summarize it, I'm looking forward, one, God willing, if I'm able to start my own company or do other things. Second, to continue inspiring other people through speaking engagements and also involving the community. Okay. Yes.
That's very good. Now, as a pharmacist, actually in the community, more especially the immigrant community, maybe we came from where this opioid crisis, using of narcotics and other things were not very common. But seeing that we are having that crisis is coming to our community because of the environment, what do you advise about the use of these and what can we do?
Well, it's a very sensitive subject to talk about, and it's so sad to see people die from opioids. And actually, it's a crisis. Like in Iowa, we practice now, it has been a law that we give naloxone, which is an antidote for opioid overdose, so that we can give it to you without a prescription, so that if you know somebody who has this opioid problem, you can come to the pharmacy. And I think even in Iowa, in Minnesota, it may be coming too, whereby you don't have to be a prescriber, or you don't need a prescriber to give you that. And my advice is that if you have that, if you're able to go in, they can just fill a questionnaire, we give it to you as a backup, and you can even teach you how to use it. You may end up saving a life. You can have it at home, and you can also have wherever you go, so that in case you get somebody that needs it, hopefully we don't get somebody who needs it, but you can do that. That's number one. Number two is, one of the things is, pain is real, depression is real. And I was listening to the Oprah show the other day, and she talked about a school in South Africa where the kid was struggling, and when she called to speak to the kid, she said, I don't get depressed, I'm an African. That is not true. It's true, depression is real, and some people default into using this pain medication as a means of relaxing them and forgetting their problems. So hopefully we will engage in the community more. And we should not just push this under the rug thinking like it's not an issue. It is an issue. And we do hope that with me and the help of others, social workers and other people, we can come up and communicate and see how we can take care of this. But that takes care, that also needs your participation. In what sense? We need us to start trusting our experts. Yes, it's so hard for you to feel like I don't want to trust Nathan because he knows me, he's going to relay this information to somebody else and I'll be ashamed in the community. That's not true. We exercise confidentiality. Whether I'm practicing at my site, whether I'm practicing in the community, we have what we call patient-provider confidentiality. And if you by any means know that I shared your information that was very confidential to me, then you can sue me, and you can take legal action against me. That's what I mean. So start by trusting us, start by coming over, and us as practitioners who are listening out there, let's also be trustworthy to this community that we are part of, so that they can be able to be comfortable to us, so that we can see how we can tackle this issue.
Okay. Well, that's very good, yeah, because that's one of the areas we are having people have depression and they do overdose. And I'm happy that you have those plans. So I know Kenya sacrificed for you. Do you have anything for them that now that's what they expect?
That's true.
You remember from Chinua Achebe's book, No Longer At Ease, how the movie progress.
Yeah, I do. And actually, it's amazing. We lost a very good writer. I mean, I love his books. He's a very good writer.
Yeah.
And if you read his books and you dig deeper, that's a subject for another day.
Yeah, yeah. That's
yes. So Kenya needs us more than ever, especially me and you out there. And that's why I'm challenging you that once you get going and you achieve what you want to achieve, we can give back to our community. Today I was looking at the situation that happened in Machakos, where a lady who was not qualified to administer very lethal drug, morphine, gave a kid 10 times the dose that was required, and the kid died. So if you haven't read about the story, just go find out Ethan from Machakos and you see what happened. It is very sad. Not that it doesn't happen in this country, but as much as it happens in this country, these cases, they can be tackled, and there's if litigation is going to be going forward, it's going to happen. People is going to be held accountable. But for the most part, and unfortunately in our country, some people do get scot-free from this kind of stuff. So what do I need to do to my community in Kenya? I can become a consultant. There are certain things I've seen here, how they are done, and I believe that if there's anybody willing and ready to work with me, I'll be more than happy to give my advice as an expert in this area and what we can do to continue providing the highest level of service to our customers and also to our families back home in Kenya. Yes, so I'm prepared for that, and there are so many opportunities back home that need us, and even I have other organizations that also do go to Kenya to volunteer, and they have medical camps, so sometimes I get involved in that. I'm not able to travel at this time, but it's been my urge that I also give, and I ask that once we communicate and we let you know which organizations they are whenever they have medical camp, we can go to our Facebook, and you can find me some of my organizations which I am linked to, and we do give in, and you don't have to go there physically. You can give your money, and then you show that some people get the service they deserve.
Now that you have asked that question, just remember this question. You are a Dr. Okioga pharmacist.
Yes.
What is the difference between you, Dr. Okioga, a pharmacist, and a medical doctor, the one good doctor, like now we have in a community, Dr. Kerani? Because that is very different, because sometimes I went to vacation and somebody broke down and they were calling me doctor. They thought I was a medical doctor. I said, no, I'm not. So what difference is between the two?
Okay, here's the thing about America. In America, when you come here and you pick a profession, you pick a niche.
Okay.
Yeah, the good thing about this country, it's not a jack of all trades. You have to be a master of something.
You have to be a master of something.
Yes, you're either good at everything and master of none, or you're good at something. So what happens is they train you on just pharmacotherapy and medication. So the doctor is trained to do diagnosis and prescription. So they will diagnose you. You'll go there, they'll do a bunch of tests. And I can look at the test. if I do rotations and I become a clinical pharmacist. So even within pharmacy, yes, you're a doctor of pharmacy, but there are specialties within pharmacy.
Okay.
So there's always a niche you have to pick. I'm in retail pharmacy.
Okay.
There's somebody who is in what you call ambulatory pharmacy.
Pharmacy.
Yes. Then there's another one we call clinical pharmacy. We have a nuclear pharmacist. We have what we call infectious disease pharmacist, who just deals with infectious disease, nothing else.
Okay.
No more, no less. They specialize in that. So for us, the thing is, even the same way they have specialties in medicine. So the same thing, they have specialties in pharmacy. So as we are trained on the art of medication and how to use medication effectively and efficiently to cure diseases.
Okay.
Yes, so that's what the difference is. The doctors, yes, they know, they can be told, yes, if a patient has asthma, you need to prescribe this medication. But it's up to the pharmacist to elaborate to the doctor and to the patient how the medication works.
Okay.
So you come in, we teach you, we tell you how it is. And if you have gone to the doctor so many times, how many minutes do they see you?
Very few minutes.
About 5-10 minutes if you're lucky. Yeah, but for the pharmacy, you're lucky, you can come to the pharmacy and take as long as you want. We'll try and answer your questions.
Okay.
Some of the concerns you have and things like that. So we have specialties. Our specialty as doctors is in the specialty of therapy and using medication.
So you have to get a doctor's prescription before you do that?
Depending on which state you are.
Okay.
Yes, some pharmacies right now we are working on what we call provider status, where we are able to write some prescriptions that you don't have to go to the ER and wait for 3 hours for you to get something that I can prescribe to you and do that. The only difference is that I don't have the diagnostic test that I can use to base my judgment on the medication I'm giving you.
Okay.
Yes.
Now that as you told your story, you had a degree in clinical science.
Yes.
And now you are a pharmacist. How do they merge?
Oh, that's even good. Thank you. They merge because that degree helped me in pharmacy school.
Okay.
Because now I know which test they use to diagnose diseases, and now I have the therapy part of it. So the only thing I'm lucky is to go get to the license as a doctor. So clinical lab science basically is they do diagnostic tests. The tests I just talked about that doctors use to tell you what's wrong with you, I run those tests.
Okay.
Yes, so I do all the testing, whether it's to find out whether you have diabetes, whether you have leukemia, whether you have cancer, any other form of cancer, whether you have, anemia. It doesn't matter, whatever it is. So that's what I did as a clinical lab science. And also, when you go in and they tell you, we want you to bring a sample for us to do what we call microbiology, to tell you whether you have amoeba, then I also do that. So I kind of have an idea, I do have an idea of what goes into testing for diagnostic purposes. Now, when I practice pharmacy in the community center, when I see a prescription and I see the medication, I can quickly relate what the doctor was thinking about. So, and sometimes if it doesn't work very well, I can call the doctor and clarify and tell them, hey, I know with the combination of medication you sent here, you're trying to treat this. Can we try something cheaper for this patient? Because we're also in the business of saving you money and also reducing the amount of medication you're taking. Yes.
Well, that's very good. Now, there was a question you told me to remind you about, to talk about the workplace, where you were almost getting a problem when you went to ask your co-worker who reported you, and what advice you can give about that.
Yes, basically I was also reprimanded the second time, and that was the last time. They told me if anything happened the third time I was going to get fired. So in America, they talk about retaliation. So anything that is spoken to you in good faith, if somebody reports you in good faith that you're doing something and you get remanded, you're not supposed to go back and confront that person. And that's where most of us Africans, we have probably gotten in trouble, even at work. Even at one point when I was working at Crystal, I almost confronted somebody because she said something that I didn't do, and I was feeling bad. And
you wanted to defend yourself.
I wanted to defend myself because this is the nature to try and defend yourself and bring your point known. So basically, knowing the law of the workplace where you work, what are the policies that are in place? It doesn't mean that when they do something wrong to you, you're not supposed to speak up. If somebody puts you in a position that you really know that you have a right not to be in that position, yes, you can speak up. But going to confront them, but at the same time, you have to make sure you do it in such a manner that they are witnesses.
Yeah.
Because otherwise they can say that you are threatening them.
Yeah.
Yeah. You know, there are 3 words I didn't know when I came to this country. One of them is attitude. You know, you go to work, they say this person has an attitude, and I was like,
you didn't know
what is attitude? And then they say, you know, when people speak to you and the way you respond, it shows that you have an attitude, and they take it very seriously.
Yeah.
And then the second term was retaliation. I didn't know what that meant, you know.
Yeah.
You cannot retaliate. You have to know this. And then the third thing was tardiness. The third terminology. You know, in my country, you showed up to work whenever you showed up.
Yeah. When you have showed up, that's okay.
Yeah, but here, they take that seriously. So those 3 terms, I mean, if you understand what tardiness means, you know, what retaliation means, and what attitude means, you find that your work environment can be better.
Oh, that's very good. Yeah, anyway, that is, we are so proud of you.
Thank you so much.
As a young man, what you have accomplished despite all the difficulties, and we wish you well. And you are so inspiring. So next time, we will invite you again to talk more. But for now, thank you so much, and we will see you again.
Oh, thank you so much for having me, and thank you for your time, for listening to us. We hope this segment was very beneficial. Please let us know, and if there's anything you want me to talk about, just talk to Dr. Mandy, and we'll be more than happy to address it in the future videos. Thank you so much.
Thank you.
Yes.